Imagine a single machine that consumes roughly 20% of everything America produces.
Right, it's just a massive scale.
Yeah, exactly. 1/5 of the nation's entire wealth just pouring into one massive swirling sector. Welcome to the deep dive.
Glad to be here.
So our mission today is to really decode this colossal, kind of fragmented beast that is the U.S. healthcare delivery system and health policy.
And it is definitely a beast.
Oh, absolutely. And we're pulling our insights today from a foundational chapter by Brian Elbel and James R. Nickman. It's from the text Jonas and Kogner's Healthcare Delivery in the United States.
Yeah, it's a great source.
And the sheer scale they present right out of the gate is just hard to wrap your head around. They note that the U.S. devotes just under 20% of its economic resources to medical care and health promotion.
Right, and it's not just money, it's people, too. Fully 11% of all American jobs are in the health sector.
11%? That's wild.
Yeah, it's a footprint so large it almost, defies comprehension. When people hear healthcare, it's very natural to just picture, like a local clinic or a doctor with a stethoscope.
Sure.
But we are actually looking at a monumental chunk of the American economy. It's an enterprise that touches every single person, but more than that, it really dictates the financial reality of the country.
Right. And, if you're listening to this on your commute or while you're making breakfast, you might be thinking, I have insurance through my job. Why do I care about the macroeconomics of this?
Which is a fair question.
Yeah. But here's why. Whether you're perfectly healthy and running ultramarathons, or you're recovering from a cold or running a small business, you are actively participating in and paying for this system.
Exactly. You pay through your taxes, you pay through the wages you don't get because your employer is buying your insurance premiums, and you pay through out-of-pocket deductibles.
You are literally invested in this.
You are. And because so much of our societal wealth is poured into this one sector, understanding how it operates and where it breaks down is crucial.
Right.
How we organize this enterprise doesn't just dictate our physical longevity. It directly impacts our economic survival as a society.
Which naturally leads to a pretty obvious question, right? How is something so massive, taking up 1/5 of our economy, actually organized?
And the text gives us a surprisingly blunt answer to that.
Yeah. It isn't. Okay, let's unpack this. Reading through the chapter, the analogy that kept popping into my head was like a construction site.
Oh, yeah.
Yeah, imagine trying to build a 100-story skyscraper, but there is no master blueprint. The plumbers, the electricians, the painters, they all show up to work independently.
That sounds like a nightmare.
Right. They aren't talking to each other, they are getting paid by completely different banks, and they all have totally different ideas of what the finished building should look like.
What's fascinating here is that the authors explicitly point out the irony of calling it a healthcare system.
Because it's an unsystem.
Exactly. It's not a single enterprise at all. Our approach to delivering medical care has evolved entirely haphazardly.
Wow.
There was never a grand, central design aimed at maximizing human health. Instead, it's been shaped more by economic incentives and opportunities than by any central design.
So it's just kind of grown on its own.
Yeah, you have massive hospital networks, private equity firms, pharmaceutical companies, and localized public health departments, all just operating in separate silos.
Let me push back on that a bit, though. Doctors take the Hippocratic Oath. Nurses dedicate their lives to helping people. Are you saying the system is just dictated by billing codes and financial incentives?
Well, it's not that the individuals providing the care lack dedication. I mean, they are incredibly dedicated. The issue is the overarching structure they are forced to work within.
Ah, okay.
To understand why there is no blueprint, the authors highlight a defining characteristic, like a deeply rooted cultural tension in America. We have an ongoing political conflict over what healthcare actually is. Is healthcare a good, like a television or a car, subject to the free market, where you get exactly what you can afford? Or is healthcare a right requiring government control?
Because we haven't agreed on the answer as a society, we just get this hybrid, fragmented construction site.
Exactly.
So if we haven't agreed on what this building is supposed to be, how do the plumbers and electricians actually get paid? If it's driven by economic incentives, we really have to follow the money.
We do. And the primary engine driving this, historically and still largely today, is what the text calls the fee-for-service system.
Fee-for-service, okay.
Yeah, in a fee-for-service model, healthcare providers are traditionally rewarded financially for providing more billable services rather than for efficiency, or actually making people better.
Meaning they get paid for the sheer volume of things they do.
Right. Every blood test, every MRI scan, every procedure is a distinct fee. The financial reward is inextricably tied to the quantity of care.
Wait, the text says patients rarely know what a service costs until after it's delivered, or sometimes ever. In what other industry would you accept buying a product without seeing the price tag first?
You wouldn't. It's totally unique.
Imagine going to a restaurant, ordering dinner without a menu, and just hoping the bill isn't $10,000.
Yeah, you'd never accept it, and yet that is the reality of American medical billing. The payment approach is fundamentally devoid of transparency.
It's crazy.
The text unpacks this lack of transparency, explaining that this lack of consumer-friendly pricing makes healthcare delivery a uniquely challenging part of the U.S. economy.
Because you can't shop around.
Exactly. When the consumer doesn't know the price and the provider is paid per service, the provider is incentivized to do more, and the consumer has no ability to say no.
Are there any brakes on this vehicle at all?
Well, the authors do note there are incremental moves happening today. There are slow shifts toward paying for value rather than volume.
Okay, that's good.
Yeah, but make no mistake, the fee-for-service chassis is still the underlying frame of the entire system.
Which brings us to this massive realization in the text. Because we largely pay for services like fixing problems, we've built a massive medical care system for when we get sick.
Right.
But what about keeping us healthy in the first place?
This is a crucial distinction the authors make. There is a vast difference between medical care and public health.
How so?
Medical care. The doctors, the hospitals, the tech takes charge when people are already ill. Health maintenance, however, relies on public health, like sanitation and pandemic response.
Okay.
And critically, it relies on addressing what they call social determinants.
So what does this all mean, the social determinants?
It means that adequate family income, high-quality education, and social connection are actually key predictors of a person's health.
So it's like, okay, think of an analogy. Medical care is the ambulance waiting at the bottom of a cliff. But health maintenance, that's the fence at the top of the cliff.
That is a perfect analogy.
Yes. And the text points out that building the fence relies on these social determinants, like your zip code or your income level.
Exactly. The authors point out a health and all approach to social policy. They emphasize that fighting issues like discrimination and abuse is just as much a part of population health as prescribing medication.
Wow.
Yeah. Your local grocery store and the safety of your street might dictate your heart health more than your cardiologist does.
So it's all connected, but with medical care pulling in one direction and population health in another, who is actually holding the reins?
That is the million-dollar question.
Well, here's where it gets really interesting. The text identifies 5 key stakeholders with competing interests. Let's break down this roster. Stakeholder number 1, individuals and consumers.
That's the listener.
Right. And they're supposed to be at the center of all this.
Supposed to be, yeah. But the text notes they're often treated as bystanders by doctors who assume they know best or by insurers who are just setting the rules.
So the consumer is sidelined. Stakeholder number 2, providers and professionals. The doctors and nurses.
Right. And they are genuinely motivated by keeping people healthy. But they are incredibly frustrated by the complex rules.
I can imagine.
They want fair pay for their extensive training, but they're bogged down by a hostile administrative environment.
Okay, stakeholder number 3, employers. They pay for a lot of this private insurance.
Yeah, so they desperately want slower cost growth. But at the same time, they want healthy, productive workers. It's a huge paradox for them.
So employers are paying these massive premiums to stakeholder number 4, the insurers.
I like to describe the insurers as the referees of the system.
Referees.
Yeah, they take on the financial risk or act as intermediaries, but they face intense pressure from everyone else we just mentioned.
Are they doing anything to fix the fee-for-service problem?
They are exploring new models, like capitated payments.
Wait, what is that?
It's basically paying a flat premium per person for the year, regardless of how many services they use. It shifts the incentive to keeping the person healthy.
Oh, like a subscription. That makes sense. Okay, and the final heavyweight, stakeholder number 5, public policymakers.
A very fractured group. They have deeply conflicting ideologies about the role of government here.
Right.
Though the text notes they generally agree on wanting slower inflation and state-of-the-art care.
So when you put these 5 stakeholders into a haphazardly designed fee-for-service system, it creates severe friction.
Oh, absolutely.
How does this friction manifest in our daily lives, and what happens when a crisis hits?
Well, we rapidly run into the text's overarching challenges. First is improving quality, like curbing avoidable medical errors.
Which are still too high.
Way too high. Second is slowing the relentless growth of expenditures, since cost is just price multiplied by volume.
And we also have an aging population, right?
Yes, which puts massive pressure on the delivery and financing of medical care. And finally, addressing deep inequalities in access and outcomes based on income, race, and geography.
The text brings up a major piece of policy regarding access, the Patient Protection and Affordable Care Act, or Obamacare.
Right, and the authors lay out the facts here really clearly. They note that the ACA dramatically reduced the number of uninsured Americans, which was really important during the pandemic.
Yeah.
But they also note that gaps still persist. Political opposition led some states to reject those expansions, so those geographic inequalities remain.
So they just report the facts of the coverage and the political realities without taking a side.
Exactly.
But speaking of the pandemic, that was the ultimate crisis, the ultimate stress test for this unsystem.
This raises an important question, especially regarding trust. The text highlights that the COVID-19 pandemic exposed incredible technological triumphs, like the rapid vaccine development.
An absolute miracle of medical care.
Totally. But alongside that, there were massive public health struggles. We saw mixed messages, a lack of coordination, and a severe breakdown in public trust.
Trust really is the invisible currency. When your system is so fragmented, trying to suddenly build collective trust in an emergency is incredibly difficult.
Exactly. It proved that scientific advancement is only half the battle. If the organizational structure is fractured, delivering that science becomes a massive struggle.
Which brings us back to you, the listener. As we wrap up, remember that you are the most important stakeholder in this massive enterprise.
Absolutely.
The challenge for tomorrow's leaders is improving quality, demanding transparency, and getting more value for the 20% of our economy we pour into this sector.
If we connect this to the bigger picture, the authors call for pragmatism and flexibility to implement best practices. It's going to take effort, but they are optimistic.
I want to leave you with a final thought to mull over. If the text reveals that our actual health is primarily determined by social factors outside the hospital walls, like our education, income, and neighborhoods,
Right.
but our money and economic incentives are overwhelmingly pumped into the fee-for-service medical treatments inside the hospital,
Yeah.
how long can our society sustain a system that so heavily funds the cure rather than investing in the cause?
That is the question.
Thanks for joining us on this deep dive. We'll see you next time.